Good morning, Nashville. Good morning, Nashville. Now, I know many of you are anxiously awaiting
for your power to be restored.
Since Sunday night's thunderstorms swept across Davidson County. And as of this morning, Nashville Electric Service has restored power to approximately 90,000 residents. Less than 40,000 Nashvillians remain without electricity. Line workers from three other states are working 24 hours a day and 14-hour shifts while observing public health protocols. As a reminder, please do not approach damaged power lines to the city and report by calling 911. I want to welcome DeCosta Jenkins, President and CEO of Nashville Electric Service, who's returned to provide a detailed update on the NES response record-setting power outage. Now, food spoilage is a serious public health concern. Anytime there is a power outage, keeps for 4 hours in a refrigerator, and 48 hours in a full freezer, with doors kept closed based on CDC guidelines. Now, if you're currently facing a food security challenge, there are several metro resources available to assist you. MNPS is providing free breakfast and lunch to all children under the age of 18 at 16 school-based locations across Davidson County between 10 a.m. and 12:30 p.m. on weekdays. And today, from 1 p.m. to 3 p.m., our office is partnering with MMPS, Second Harvest Food Bank, and Metro Parks to distribute a family meal box at the Madison, Hartman, Hermitage, and Luby community centers. Addresses for these locations and 6 other distribution sites operated by MMPS can be found at the Metro COVID-19 website. You can also dial 211 or visit our website to obtain direct food assistance through the COVID-19 Response Fund. Do not hesitate to use these resources if you or your loved ones are facing hardships, and visit covid19.nashville.gov to learn more. Now, 13 crews from Metro Public Works have responded to 367 fallen tree and storm debris calls since Sunday evening. You can request debris removal from public rights-of-way by calling 311 from within Davidson County or visiting hub.nashville.gov at any time. I urge everyone to continue following the Safer at Home order by staying at home whenever possible and only leaving your homes to run errands that are absolutely essential. Enforcement teams comprised of Metro Health and Metro Police personnel have worked hard to educate and inform businesses about how to safely observe the Safer at Home order over the past several weeks. But a successful economic restart will require county-wide compliance and coordination. Measured enforcement actions will be applied to protect public health and to ensure a sustained reopening as we move through the phases of our reopening. Now, Public Health Order number 4 is also in effect to expedite our return to business as usual. So remember to wear a face covering anytime you're out in public to protect yourself and those around you. Starting today, all Davidson County residents can pick up a free face mask provided by the state's COVID-19 Unified Command by visiting any of the following Metro Public Health Department locations: the Lentz Public Health Center at 2500 Charlotte Avenue, the Woodbine Public Health Center at 224 Oriole Avenue, and the East Public Health Center at 1015 East Trinity Lane. Hours of operation are 8 a.m. to 4:30 p.m., Monday through Friday. Now, our thoughts are with all the Nashvillians who are sick with the coronavirus, and we extend our heartfelt condolences to the families and friends of those who have died. All of us are eager to return to a normal daily routine and safely get our community back to work. But being cautious with our public health decisions will ensure that we can restart our economy and keep it running smoothly without interruption. We are closely monitoring the benchmarks required to begin safely, reopening restaurants, bars that serve food, retail establishments, and commercial businesses. And we will continue to provide updates on these metrics every morning. You can also visit covid19.nashville.gov to review the COVID-19 dashboard, which includes our coronavirus transmission rate, the 14-day new case trend, the ability to conduct countywide contact tracing investigations, COVID-19 testing capacity, and our local hospital capacity. As we track these reopening criteria, we are also closely monitoring the pattern of the disease to see how COVID-19 is affecting different communities in Nashville. And today's news on our number of positive cases overall in Nashville, however, is very good. This morning, I'd like to welcome Leslie Waller, epidemiologist at the Metro Public Health Department, who is here to discuss the Metro COVID-19 heat map and what our epidemiologists have learned about social distancing protocols based on their contact tracing investigations. I'd also like to welcome Alora Young, Nashville's 2020 Youth Poet Laureate. Alora is a junior at Hillsborough High School, where she is an IB diploma candidate and serves as the chief editor of the Borough Underground, Hillsborough's own literary magazine. In her free time, Alora enjoys playing chess and participating in theater productions, and she hopes one day to serve on the United States Supreme Court. We are thrilled to have Alora join us this morning, and I want to thank the Metro Arts Commission, the Nashville Public Library, the Nashville Public Library Foundation, Urban Word, and Southern Word for working with our office to support the Nashville Youth Poet Laureate program. And finally, I'd like to wish a happy National Nurses Day to all the dedicated nurses in Davidson County who work with Metro Public Health, Metro Schools, and our area healthcare partners, especially during the time of the coronavirus. Today, we celebrate you and the tremendous sacrifices you make each and every day in the service of others. And as always, I urge you to visit the Metro's COVID-19 website, where you can contribute to the COVID-19 Response Fund to learn how to obtain direct financial, food, mental health, and social service assistance. And now I'll turn it over to Dr. Alex Shahanger, chair of the Metro Coronavirus Task Force.
Thank you, Mayor Cooper, and good morning. Here's the latest on coronavirus in Davidson County. As the mayor mentioned, we did have another death as a result of virus, a 55-year-old gentleman. I send my sympathies to his family and his friends. That now brings our total fatality count to 33. Now to the confirmed cases. We now have 3,346 cases. That is an increase of 24 cases in the last 24 hours. 1,567 of those cases are active, and 1,746 residents have recovered and have been cleared. Additionally, here's the latest race data we have collected. The Davidson County confirmed cases include 33% white, 12% Black or African American, 13% multiracial or other, 7% Asian, 6% unknown, and 20% pending. And of the 33 Nashvillians who have died, 16 were white, 13 were Black or African American, 3 were listed as other, and 1 was listed as Asian. As I've mentioned before, COVID-19 highlights health disparities in our society, and where minorities and those with limited access to healthcare are seriously impacted disproportionately. We continue to work to making tests available to everyone. We place our community assessment centers in communities where people may not have easy access to healthcare. They are now open 5 days a week to expand testing further. Next week, we'll have a mobile testing team that will help expand testing across our city. I will provide more information on this initiative over the next several days. The assessment centers are open today, as I mentioned, until 3 p.m. And our assessment hotline is open today and every day from 7 a.m. to 7 p.m. These hotlines and centers are free for Nashvillians and those who think that they need to get tested or screened. The hotline phone number is 615-862-7777. You can also visit our website, covid19.nashville.gov, to see the current dashboard and learn more about testing. Now, you can also learn more about our roadmap to reopening as well on the website. Now, until we open, though, we need you to stay at home. Only go out if it's absolutely necessary. And if you go out, keep your distance and wear a face covering. Take care of each other and take care of your loved ones. Now, I also want to wish everyone a happy Nurses Day. As somebody who works daily with nurses, who see their impact on patients every single day, and more generally have seen the impact of nurses in our community, I am grateful to all my nursing colleagues, and I hope they have a great day today and a great Nurses Week all week and a great day every day. And especially at this time when we depend so much on our nurses and healthcare professionals, I'm grateful. So with that said, I would like to now introduce my colleague, Mr. Leslie Waller. Thank you.
Good morning, everyone. I've talked previously about the geographic clustering in the southeast part of the county, and we've discussed ways we're working to provide additional resources and support to that area. We're progressing with our partners at Siloam and Turk to incorporate COVID-specific community health workers into our response team. And we're excited to share that we expect our work with these workers to start this weekend. A lot of careful planning has gone into this over the past 3 weeks, and I'm immensely grateful for these two partners. Many of us have also seen a lot of national and local discussion regarding disproportionately affected communities during the COVID pandemic. I think our updated heat map this week reflects that, as it has for a number of weeks now. I was asked over the weekend what trends might be emerging, and what I couldn't stress enough was the fact that the impacts of COVID are very real for Nashville's more vulnerable populations. In fact, about 30% of cases in the last 14 days were identified as part of a cluster that involved one of these vulnerable populations, and a further 30 to 40% were household or other secondary cases to those. We have seen a high proportion of cases working in essential jobs where there are fewer luxuries and less flexibility than a typical office job. There are inherent environmental challenges in many of these settings, and that's the nature of the work. We have also noted, anecdotally, that many of these cases fall into a relatively lower socioeconomic status due to these essential jobs, and therefore might lack resources others of us enjoy. Our team is starting to explore this issue in a more concrete way. And then we have other communities where it may be difficult to properly practice disease prevention behaviors recommended by CDC, like long-term care facilities and sheltering options for the city's homeless or unstably housed population. Again, these environments are inherently more prone to the spread of an infectious disease, and we have to work to mitigate that. To summarize, our response team does realize that zip codes and neighborhoods are often a proxy for income and resources. We aim to provide material and tangible support to these communities and facilities to continue our focus on reaching these groups who are at higher risk. Through testing capacity, a quick cluster investigation response that includes an intensive contact tracing initiative, and continued engagements and partnerships, our public health team can continue to work across organizations to mitigate the spread of COVID in our communities. With that, I would like to introduce you all to DeCosta Jenkins with the Nashville Electric Service.
Good morning. Many thanks to the Mayor's Office for its continued support of our teams as we work to restore power throughout Greater Nashville. I want to thank the hardworking people at NES for what they've done over the last, 36 hours. We have restored power to more than 103,000 customers during that time. We started with 131,000 outages Sunday afternoon. As of this morning, we're down to 28,000, so we've made quite a bit of progress. And just again, to put that in perspective, with respect to the outages related to the tornado, we had 50,000 out, and with the flood that occurred over 10 years ago, it was 90,000 out. So just to put it in perspective, this was, as the mayor mentioned earlier, a record-setting outage. Our focus first is on repairing the major circuits to repair power to the maximum number of customers. And the good news is we've repaired 56 major circuits so far, and probably later on today we'll be transitioning from the major circuits to some of the smaller outages. We're grateful to the linemen from Ohio, Virginia, and Kentucky who've joined our crews an additional 36 buckets, and almost 100 professionals. These incredibly hard-working professionals are working tirelessly on behalf of our customers. We can't thank them enough. So again, the things that people ask me, why is it that I don't see any NS trucks? And again, want to explain that we're working on the larger circuits first. And once we finish the work on the larger circuits, then you'll see a lot more activity in your individual neighborhood. And then the other thing is, why does it take so long? And as I explained before, this is the most significant outage that I've experienced in my career. As I said, with the flood, it was 90,000. With the last tornado, it was 50,000. We started at 131,000. But I want to assure you that every outage is a priority, and we're working 24/7, and the guys are working 14-hour shifts. We're doing everything to get your power on just as soon as possible.
Thank you, Mr. Jenkins. I'd now like to introduce Alora Young, a junior at Hillsborough High School and Nashville's 2020 Youth Poet Laureate, who is joining us by WebEx video conference.
I'm never afraid this city will forget to breathe. The silence downtown rings out like tornado sirens, but if you peer into our windows, the city keeps singing. Disaster after disaster makes most broken. It made us artists. Our music is an iron lung. 200 years and the city still feels young because there will always be more children, more lyrics, more hope that tomorrow brings something luminescent. The thing about people is we all exist with as many faces as friends. When the storm comes, we empty the shelves. We shield the children. We watch our backs because the storm will make you see yourself. When the storm comes, you cannot lock the door. When the sickness comes, you can't forget anymore. Disasters make us remember the things we fight for, live for. Like when your sister says she loves you, you fight to believe her. You never realize how fast disaster can show you the worst side of humanity, or how it can show you beauty. Somehow, this quarantine has given me sanctuary. It is saving the only light left, the way the clap of our hands keep time with our syncopated heartbeats. I call it daylight savings time. My city is its bluegrass rhythm. And I know that tomorrow will sing because every choice we make in darker times splinters into different timelines. There's always a timeline where we come together as a community. And there's always a timeline where we fall apart. There is never a more resounding still than the moment when reality splits. In the hush, another world is born. In the moments when the wind is prepped to decimate millions of years of evolution in a single breath, there may not be silence, but there is stillness. I imagine a diametric mind. The shallow echo of a heartbeat and eardrums may remind us that we are alive. It may remind us how on a different timeline, any place could be in the eye of the storm. We are a city that has taken hits, and we have the right to mourn. And may it remind us that there is more. We may have run out of clarity, but Nashville will never run out of possibility.
Thank you, Alora. That was beautiful. We will now start the Q&A segment of today's briefing. As I announce your name, you may proceed by asking your question over the air. We'll start with Harriet Wallace from Fox 17. Harriet?
Yes. Hi. Good morning, everyone. This question is for our doctors there. We at Fox 19 came across the New York Times article, which is saying that Nashville could likely be a city where we have a serious outbreak. Wanted to see if you all are aware of this study, if there's any merit to this study, and if so, what precautions are we looking at taking and how this could affect lifting the safer at home order. Thank you.
Thank you, Harriet. Dr. Jungir?
Harriet, good morning, and thank you for that question. I did see that study today, and it actually took me by surprise because we've been following the doubling time, which is what they're using to make their predictions on which cities have the higher likelihood of a second wave or whatever terminology they use. Our doubling time, based on essentially 4 separate sources that I trust, including Ms. Waller's team, has been about 16 for a long time, and we'll show that data to you soon. The New York Times had a doubling time of around 9.3, I believe is what the study said, and I think, and I asked some other experts independent of my own opinion of this, and they seem to agree. I think they're, first of all, using some of the state data, which may be a little more delayed than what we have, and there's such a wide variability in numbers. So, for example, one day the number may be 33, and the next day 140, and I think they just looked at a really small scope, looked at the variability, and looked at the entire trend of cases that we've had since March. So our doubling time has been constant around the 16 range for a long time, and I'm happy to show that data maybe as soon as tomorrow to you. So I'm actually a little puzzled when I saw that because I'm really proud of what we've done as a city. Our hospitalizations have been low. Our death rate has been 1% or lower, and we've really have flattened the curve. And again, that surprised me as well. But I'd like to learn more about it. But I don't believe that story. Thank you.
Elizabeth Lane at WKRN. Elizabeth, you're on the air.
Hi, good morning. My question goes primarily to Mayor Cooper, and that is, I know a number of bar owners down on Lower Broadway are planning to call on him to repeal the safer at home order on Friday. They are concerned that they haven't had a source of income for going on 2 months here. And my question is that a lot of them are dealing with the fear that we might not move into phase 1 anytime soon. And so what's the response to that? And is there any chance that maybe some of these phases in this reopening plan could be tweaked if we get stuck in a particular holding pattern?
Thank you, Elizabeth. Mayor Cooper?
Well, thank you, Elizabeth. Boy, I welcome the engagement with the bar owners, we all in Nashville are deeply sympathetic to this huge missing part of our economy. We have to get back to work and get back to work as quickly as we can, keep our staff and our customers safe. I believe with today's news, we are proceeding in a very good direction to get us launched onto phase 1. But this is our learning time as a community, how to do phase 1 successfully. That's going to be PPE, that's going to be masks, that's going to be protocols, that's going to be walking through with your employees how to manage in phase 1. Now, bars are not open in phase 1. So as a restaurant serving food off of a menu with social distancing protocols, that is possible. But that will, of course, in phase 1 for them and everyone else be a challenge to be able to do that and not spread the disease as we learn as a community how to work together to live with the presence of coronavirus as a constant danger in our community. And it's going to take good technique and good protocols to do it. And I'm excited that everybody, all restaurants, bars that start being a restaurant because they're serving food primarily to their customers, for them to open in a way that keeps everybody safe. And again, I urge them to consult with the public health department on any questions about protocol that might advance public safety.
Our final question today is from Nancy Amons at WSMV. Nancy?
Hi, thank you. Actually, I have 3 questions. First, I would like to know how many of the new cases are from the fairgrounds or the Mission, and is the death connected to either of those places? Second, I had a viewer ask me, why aren't fast food workers required to wear masks? And third, I would like Leslie Waller to please describe what kind of work exactly are the caseworkers going to be doing in Southeast Nashville? Thank you.
Thank you, Nancy. Your first question about the fairgrounds and admissions will be addressed by Dr. Jahangir.
Yeah. Hi, Nancy. The 24 reported today, none of them were from the Mission or the fairgrounds. Those numbers were reported previously from what I've just confirmed. The second question regarding fast food, what about it? Why are they required to wear? Oh, why are they not required to wear a mask? My understanding is that they should be wearing masks for, I don't know. Well, I'm sorry for that. Let me get more clarification on that. And in fact, Dr. Caldwell will answer that. And then Ms. Waller will answer the third question. Thank you.
Right now, Public Health Order 4 mandates the signage that says that we want people to wear masks upon entering any publicly accessible facility. I also have in the order that employers should require employees to wear masks. So that is my expectation. And we're looking at other options moving forward. But I expect when I go into a place that masks are worn. I went for coffee this morning. There was somebody standing outside with a mask. They were not letting anybody into the facility without a mask on. Those are even the customers. So I remind everybody, make sure you have a mask available because we want you to be able to go through the community using social distancing, and I expect employees to wear masks. Thank you.
So the community health workers are going to be working really closely with our investigations team. It's going to be a blend of a little bit of social work, a little bit of investigation work themselves. They'll be helping us with cases where contact tracing might be a little bit more difficult. And then they're also going to be ensuring that families have the resources that they need while they're in quarantine and isolation. So it's going to be a blend of a little bit of public health, a little bit of social work.
There are no more questions in the WebEx queue this morning. I'd like to thank Leslie Waller, DeCosta Jenkins, and Alora Young for joining us. A recording of today's briefing will be made available later this afternoon. Thank you for joining us. This concludes today's Metro COVID-19 press briefing.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.gov.